Here, the today topic is leprosy. It is a topic of microbiology. Leprosy is also known as Hansen disease. Leprosy is a bacterial disease of the skin and nerves, which can progress to involve internal organ if it is not treated, and it is caused by bacterium, Mycobacterium leprae, and discovered by Gerhard Henrik Armer Hansen was a physician who first identified Mycobacterium leprae as the cause of leprosy in 1873, so it is also known as Hansen's disease from the name Hansen. Mycobacterium leprae is a gram-positive aerobic rod-shaped bacillus. Facultative obligate intracellular organism is a acid-fast bacillus because of its inability to grow on agar, newt mice and nine-banded armadillos are used as animal models. The bacteria resides in different ocular parts of the body, skin and peripheral nerves mainly. Also involves skin, peripheral nervous system, upper respiratory tract, eyes, testes. Mycobacterium leprae has a unique tropism for peripheral nerves, and disease, if it is not treated, leads to characteristic deformity and profound social stigma. Now, pathology. It is mainly a granulomatous disease affecting peripheral nerves and the mucosa of the upper respiratory tract. Granulomatous refers to a granulomas, which are lesions of epithelioid macrophages. And transmission mechanism is still unknown. How this is transmitted. The main reservoir is human, although human-to-human arousal spirit of nasal secretion is the most likely mode of transmission in most of the cases. Nasal oral droplets and dermal inoculation. Transmission. The disease is not spread by touch since the mycobacterium are incapable of crossing the intact skin, as and living near people with leprosy is associated with increased transmission. Sometimes get contact, and we are studying about Ridley-Joplin classification system of TB and lepromatous. Tuberculoid TT, borderline tuberculoid BT, borderline BB, borderline lepromatous BL, and lepromatous LL. These of five types. According to WHO, the WHO recommends classifying leprosy according to the number of lesions and the presence of bacillus on a skin smear. It is of two types, paucibacillary and multibacillary leprosy. In paucibacillary, leprosy is characterized by 5 or fewer lesions with absence of organism on smear, but multibacillary leprosy is marked by 6 or more lesions with possible visualization of bacilli on smear. Immunology, tuberculoid leprosy. Seen in the patient with a high degree of resistance, skin lesion few and sharply demarcated. In this leprosy, neural involvement early and may be pronounced, leading to deformities, and the bacilli are scanty here. And paucibacillary disease, skin test with lepromin elicit a strong positive response, and the prognosis is good. Lepromatous leprosy, patient with low resistance, superficial nodular lesions, ulcerate secondary infections, distortion. They are also unresponsive to lepromin negative, CMI deficient, prognosis is poor, and multibacillary disease. Cardinal signs of leprosy. Skin lesion, typically anesthetic at the tuberculoid end of the spectrum, thickened peripheral nerves, and loss of hair and sweating, and peripheral neuropathy are the main cardinal signs of the leprosy. The subtype of leprosy often determines the degree of skin involvement. In the clinical picture, acid-fast bacilli on skin smears or biopsy. Acid-fast is a property of mycobacterium in which they resistant to decolorization by acid during staining. This is helpful and diagnostic tool for Mycobacterium tuberculosis and Mycobacterium and lepromin skin test. It is a delayed type of hypersensitivity, assess a patient's ability to mount a granulomatous response against a skin injection of killed Mycobacterium leprae. Patients with tuberculosis are positive, saw the positive response with more than 5 mm of size of lesion, and patients with lepromatous show no response. Early reaction: Fernandez erythema and induration within 20 to 4 24 to 48 hours and remains for 3 to 5 days, and late mistura 1 to 2 weeks, indurated skin nodule. Applied importance: classify the lesion of leprosy patient, to assess the prognosis and response to treatment, to assess the resistance of individual to leprosy. And lepra reactions, there are the lepra reactions includes type 1 reaction, reversible reaction, skin in borderline leprosy. It is a type 1 reaction is a reversible reaction seen in borderline leprosy. Cell-mediated immunoreaction leads to influx of lymphocytes into lesions and shift to tuberculate morphology. Type 1 reaction is painful and tender nerves, downgrading reaction when occurs before initiation of chemotherapy, and reversible reaction after the initiation of chemotherapy. Th1 responses with INF gamma and interleukin 2. Corticosteroidal treatment is a treatment of choice. Type 1 reaction, we can see type 1 reaction in the figure here. And type 2 reaction, the word erythema nodosum leprosum occurs in bilateral form of leprosy. Crops of tender inflamed subcutaneous nodules appear with a fever, lymphadenopathy, and erythroalgia. Arthritis, uveitis, orchitis, glomerulonephritis can be seen here, and TNF immunocomplex deposition. Ts2 cytokinin and profile interleukin 6 and interleukin 8. Thalidomide is a choice of treatment in this reaction. And you can see the picture of type 2 reaction here: erythema nodosum leprosum